In this video, I explain what personality disorders are and how they can affect the lives of the people affected. You will learn about the different types of personality disorders and how they manifest. Personality disorders are long-term patterns of thoughts, feelings, and behavior that deviate from societal norms. These patterns can lead to problems in everyday life, such as in relationships or at work. People with personality disorders often have difficulty regulating their emotions. They respond to situations differently than most others. The causes of personality disorders are diverse and can include both genetic and environmental factors. A difficult or traumatic childhood environment can play a role. Experiences such as neglect or abuse can also contribute to the development of a personality disorder. Sometimes, a genetic predisposition is responsible for these disorders. There are different types of personality disorders, each with distinct behavior patterns. Among the most well-known are narcissistic personality disorder and borderline personality disorder. Each disorder manifests in its own way, but they all share the common feature of making daily life more difficult. The disorders can appear in behavior, perception, and interactions with other people. The symptoms of personality disorders vary depending on the type of disorder. They may be related to how someone behaves in social situations, or how they perceive their own emotions. Extreme reactions to stress or disappointment are also common. People with personality disorders often struggle to maintain stable and healthy relationships. The diagnosis of a personality disorder is made by professionals such as psychologists or psychiatrists. They use various interviews and tests to determine whether a person has a personality disorder. A key factor is long-term observation of behavior and emotions. Only through comprehensive analysis can it be determined whether a personality disorder is present. Treating personality disorders is often lengthy and requires a great deal of patience. In many cases, psychotherapy is used to help individuals recognize and change their behavior patterns. Medication can also be supportive, especially when additional mental health issues such as anxiety or depression are present. Early treatment can help individuals cope better with their disorder. Dealing with people who have a personality disorder requires a lot of understanding and patience. It is important to respect their perspective while also setting clear boundaries. Some people with personality disorders can be challenging in social situations. Good communication and support are crucial to avoid conflicts and to promote the well-being of the individual. Personality disorders can significantly impact daily life. Those affected often have difficulty maintaining stable relationships or keeping a job. They may struggle to control their emotions or navigate social situations. This can lead to isolation or further mental health issues that make life even more challenging. Although personality disorders often arise from a combination of genetic and environmental influences, there are measures that can help reduce the risk. A supportive and stable environment in childhood can have a positive impact on psychological development. Early detection and treatment of emotional problems can also help prevent the progression of personality disorders. However, prevention is not always possible as the causes are complex.